Hello there, my name is Sarah, as most of you know. My project today is on arthritis. To start with, arthritis is inflammation of one or more of your joints, made from the prefix arthro, which meaning joint, and itis, meaning inflammation. The main symptoms of arthritis are joint pain and stiffness, which typically worsen with age. The most common types of arthritis are osteoarthritis and rheumatoid arthritis, but we're going to go into depth on a couple others as well. Going into the common types of arthritis, osteoarthritis causes cartilage, the hard slippery tissue that covers the end of bones where they form a joint, to break down. The most common type of arthritis, osteoarthritis, involves wear and tear damage to your joint's cartilage. Enough damage can result in bone grinding directly on bone, which causes pain and restricted movement. This wear and tear can occur over many years, or it can be hurried along by a joint injury or infection. When the joint symptoms of osteoarthritis are mild or moderate, they can be managed by balancing activity with rest, using hot and cold therapies, regular physical activity, maintaining a healthy weight, strengthening the muscles around the joint for added support, using assisted devices, taking over-the-counter pain relievers or anti-inflammatories, and avoiding excessive repetitive movements. Moving on to infectious arthritis, which occurs when bacterium, virus, or fungus can enter the joint and trigger inflammation. Examples of organisms that can infect joints are Salmonella, Shigella, Chlamydia, gonorrhea, and Hep C. In many cases, timely treatment with antibiotics may clear the joint infection, but sometimes the arthritis becomes chronic. The next one is metabolic arthritis, or gout, which is another common type of arthritis. Uric acid is formed as the body breaks down purines, a substance found in human cells and in many foods. Some people have high levels of uric acid because they naturally produce more than is needed, or the body can't get rid of uric acid quickly enough. In some people, the uric acid builds up and forms needle-like crystals in the joint, resulting in sudden spikes of extreme joint pain or a gout attack. Gout can come and go in episodes, or if uric acid levels aren't reduced, it can become chronic, causing ongoing pain and disability. Now moving on to rheumatoid arthritis, or RA as you're going to hear me pronounce it a couple of times, is an autoimmune disorder that first targets the lining of joints, synovium. In rheumatoid arthritis, the body's immune system attacks the lining of the joint capsule, a tough membrane that encloses all the joint parts. This lining, known as a synovial membrane, becomes inflamed and swollen. The disease process can eventually destroy cartilage and bone within the joint. A healthy immune system is protective. It generates internal inflammation to get rid of infection and prevent disease. But the immune system can go awry, mistakenly attacking the joints with uncontrolled inflammation, potentially causing joint erosion and may damage internal organs, eyes, and other parts of the body. Rheumatoid arthritis and psoriatic arthritis are examples of inflammatory arthritis. Researchers believe that a combination of genetics and environmental factors can trigger autoimmunity. Smoking is also an example of an environmental risk factor that can trigger rheumatoid arthritis in people with certain genes. With autoimmune and inflammatory types of arthritis, early diagnosis and aggressive treatment is critical. Slowing disease activity can help minimize or even prevent permanent joint damage. Remission is the goal and may be achieved through the use of one or more medications known as disease-modifying anti-rheumatic drugs, or DMARDs. The goal of treatment is to reduce pain, improve function, and prevent further joint damage. So now I'm going to go on a little history lesson of rheumatoid arthritis specifically. Please be aware that I may mispronounce some of these names, mainly due to my inability to pronounce long French names. There will be a few accompanying slides from some paintings done by one Peter Paul Rubin, which remains as one of the most pronounced pieces of artistic evidence from the existence of rheumatoid arthritis, before the individual that I'm going to show you and explain a little bit more in depth, and his thesis. A few others are from an anonymous painter from the Flemish Dutch school that shows more images of rheumatoid arthritis. So, the first recognized description of rheumatoid arthritis was in 1800 by the French physician Dr. Augustin Jacob Landry Beauval. That's one of those French words. The name rheumatoid arthritis itself was coined in 1859 by British rheumatologist Dr. Alfred Baring-Garrod. He examined and treated a handful of patients with severe joint pain that could not be explained by any other maladies at the time, such as rheumatism or osteoarthritis. Unlike gout, this condition mainly affected the poor, affected women more often than men, and had previously been ignored by other physicians who, concerned with earning acclaim and compensation for their work, usually chose to treat more richer patients. He hypothesized that these patients were suffering from a previously uncharacterized condition, which he named primary ascentic gout. Though Landry-Beauveau classification of rheumatoid arthritis as a relative of gout was inaccurate. His dissertation encouraged other researchers in the field of bone and joint disorders to further study this disease. Modern advances in the medical treatment of RA have greatly alleviated patient symptoms. There are many remedies but very few scientific reasons for arthritis. Doctors and scientists believe it may involve a combination of genetic, environmental, and random factors. Clues to the history of the disease can potentially be obtained from consideration of its evolution during the development of human civilization. From a historic perspective, evidence of the existence of RA in various eras and locations has come from an analysis of ancient texts, Renaissance artwork, as you'll see, and more recently, post-mortem remains of hundreds of exhumed skeletons. RA generally begins to manifest in individuals between the ages of 30 and 65. The estimated average life expectancy was just under 30 years when RA was first described in the year 1800. Due to the life expectancy being so short, it is possible that individuals who would have developed RA in ancient times died before the onset of the disease. This could partly explain why RA may have been much less common in previous centuries. Combined with the skeletal evidence showing RA in ancient times, a reasonable conclusion seems to be that RA was problematic for our ancestors, but likely for very few of them. So science tells us four very distinct things about the origins of this disease and what causes it. For one, RA is not a disease of recent origin, and was both present and problematic hundreds, if not possibly thousands of years ago, potentially with a geographic distribution distinct from its current profile. RA also occurs as a response to an environmental stimulus or stimuli experienced by genetically susceptible individuals. The identities and origins of these stimuli or inciting events are still incompletely known, although tantalizing clues have been emerged. Also, distinct environmental triggers may be important in subsets of patients with RA. Thus, the historical analysis of RA needs to incorporate the likely possibility that what we currently define as RA is more than one disease. Now that we know where it is, where and when it possibly came from, how do we diagnose this? Arthritis diagnosis often begins with a primary care physician, who performs a physical exam and may do blood tests and imaging scans to help determine the type of arthritis. An arthritis specialist or rheumatologist should be involved if the diagnosis is uncertain or if the arthritis may be inflammatory. Rheumatologists typically manage ongoing treatment for inflammatory arthritis, gout, and other complicated cases. Orthopedic surgeons do joint surgery, including joint replacements. When the arthritis affects other body systems or parts, other specialists such as ophthalmologists, dermatologists, or dentists may also be included in the healthcare team. A doctor may also perform lab tests, imaging of the joints, prescribe medication, or even look to alternative medicine to treat arthritis. Lab tests can help pinpoint the type of arthritis you may have. Fluids commonly analyzed include blood, urine, and joint fluid. To obtain a sample of joint fluid, a doctor will cleanse and numb the area before inserting a needle in your joint space to withdraw some fluid. Your doctor may request imaging of your joints. These types of tests can detect problems with your joint that may be causing your symptoms. Examples include X-rays, computerized tomography or CT scans, magnetic resonance imaging or MRIs, and ultrasounds. Now, arthritis is unable to be completely treated, but there are medications that can help, keep it in check for the most part. The medications used to treat arthritis vary depending on the type of arthritis. Commonly used arthritis medications include analgesics. These medications can help reduce pain but have no effect on inflammation. Examples include acetaminophen like Tylenol, tramadol, and narcotics containing oxycodone or hydrocodone. NSAIDs, nonsteroidal anti-inflammatories, reduce both pain and inflammation. Over-the-counter NSAIDs include ibuprofen and naproxen sodium or Aleve. Some types of NSAIDs are available only by prescription. Oral NSAIDs can cause stomach irritation and some may increase your risk of heart attack or stroke. Some NSAIDs are also available as creams or gels which can be rubbed on joints. Counter-irritants. Some varieties of creams and ointments contain menthol or capsaicin, the ingredients that makes hot pepper spicy. Excuse me. Rubbing these preparations on the skin over your aching joint may interfere with the transmission of pain signals from the joint itself. Disease-modifying anti-rheumatic drugs, or DMARDs for short, often used to treat rheumatoid arthritis. DMARDs slow or stop your immune system from attacking your joints. Examples include methotrexate, Trexol, and Plaquenil. Biologic response modifiers, typically used in conjunction with DMARDs. Biologic response modifiers are generally genetically engineered drugs that target various protein molecules that are involved in the immune response. Corticosteroids. This class of drug, which includes prednisone and cortisone, reduces inflammation and suppresses the immune system. Some alternative medicine that you can use that some people use for arthritis, but there is little reliable evidence to support the use of many of these products, include acupuncture, glucosamine, yoga or tai chi, or massage. Now, what can be done about arthritis? There are many things that can be done to preserve joint function, mobility, and quality of life. Learning about the disease and treatment options, making time for physical activity, and maintaining a healthy weight are essential. Arthritis is a commonly misunderstood disease. The Arthritis Foundation is the only nonprofit organization dedicated to serving all people with arthritis. You can check out more on the website arthritis.org, which shows many resources for learning about arthritis if you're interested. Going along on some of the symptoms, the most common signs and symptoms of arthritis involve the joints. Depending on the type of arthritis you have, your signs and symptoms may include pain, stiffness, swelling, redness, and decreased range of motion. Some risk factors also include family history, age, the sex. Women are more likely to get it than men, to develop rheumatoid arthritis specifically. Previous joint injuries, obesity, complications, and severe arthritis. Obesity, complications, and severe arthritis. Now, I hope this presentation helps you get to know a little bit more about arthritis. I know it was kind of long, and hopefully the pictures and everything kind of kept you interested. Hopefully this taught pretty much what you need to know and the various types and everything that goes along with it. Thank you for watching and listening to me ramble, and have a great rest of your day.